I'm Dr. I.
I'm Dr. J, and this is Second Opinion with the Twin Doctors.
All right, it is my favorite part of the day, other than bedtime. Doctor, give me the news.
It's those GLP-1 medications that are in the news. Now, you guys have heard about them, Zepbound, Wegovy, Ozempic, and you guys know that they are amazing for weight loss, but guess what? There's news.
More.
If you're a man, these GLP-1 medications can make you a muscular Hulk. They can make you sharp of mind, and they can give you nocturnal prowess. Why is that, you ask? It's simple.
Okay.
Basically, GLP-1 medications have been found to increase men's testosterone levels. Now, it makes sense when you think about it. When you're taking a GLP-1 medication like Zepbound, Wegovy, Ozempic, you're trying to lose weight. When you lose weight, you lose fat. When you lose fat, two things happen. Number one, fat tissue in all people produces a form of estrogen called estrone. Estrone is the antithesis. It is the nemesis of testosterone. So when you lose weight, you produce less testosterone, or less estrogen, your testosterone levels grow. But second thing is, fat tissue produces an enzyme called aromatase, which again breaks down testosterone. So less fat tissue, less aromatase, more testosterone, and before you know it, you are like a Hulk. You're a muscular man, your mind is sharper because testosterone is good for the man's mind, and there's increased nocturnal prowess, if you know what I mean. And that's what's in the news, guys. And now, on to our, I made that sound really exciting,
You really
right?
did, it sounds like a commercial.
And now on to our main discussion, truth be told. Oral health is body health, and we've got an amazing guest with us, Dr. Sebastian Lomas. Most people call him Dr. Seb Lomas, and he is an integrative or a biological or a holistic dentist. Dr. Seb, thank you so much for joining us.
Oh, thanks for having me. I love that little intro. It was amazing and made me chuckle. Truth be told, it's something that I need to take on, I think.
There you go. There you go. You can have it. You can have it. You can use it in the UK. We'll use it here in the US. Okay, we got our little naming rights together. But yeah, truth be told. So first thing I kind of wanted to talk about. We're going to get all into integrative dentistry and exactly what it is, because I hate to admit it, but before doing research for this show, I really didn't know what an integrative or a holistic or a biological dentist was. And I think that people would be really surprised to find out that there's this entire, not different wing of dentistry, but this entire different approach to dentistry that they maybe don't know much about. But first, what I really want to talk about is your journey to becoming an integrative dentist. I had read some articles, saw some podcasts where you described that you had a pretty interesting journey from a chemist who at one point wanted to be a dentist, didn't become a dentist, later became a chemist, had some health issues that were pretty significant, led to an ICU stay.
You're telling the story.
Well, no, I'm laying the foundation.
He's like, did I get that all correct?
I know, right?
You tell it better than me.
No. But it sounds like your wife, who was big into holistic medicine, kind of directed you towards that as you were dealing with these health issues. But please.
I think you have a fan, Dr. Seb.
You do have a fan, Dr. Seb. So, okay, but tell us your story. Yeah.
It's essentially that. Like, I had this drive as a kid to do something scientific, and I went and did, researching, what can I do? Doctor, medicine, scientist. And I just started working in a dental practice. And I loved the fact that you could get someone out of pain within an instant, and they'd be your friend at the end of it by doing an anesthetic in this area. And then they were out of pain, and the next day were like, oh my gosh, thank you so much for that. I can actually think again, And so I fell in love with it, and I ended up nursing back in the day where you could nurse without any qualifications, and just going in there, helping, suctioning, and did that for 7 years. And then I was, like you said, I was heavy into my sport and my understanding of I was going to make a joke about the prowess then, but coming into the age where you're kind of thinking about other things, right? And my mind went off the studies, and I didn't get the grades to get into dentistry. So I thought, maybe I just wanted to get a good job, earn decent money, work in London. And I thought, right, what's a good degree that I can do? Chemistry. Did chemistry, hated the biochemistry, hated remembering all of everything and trying to work out how it worked. But ended up getting a first class of honours in the UK, which is pretty high. Walked into a graduate scheme in London for basically the Japanese equivalent of IBM, and ended up becoming their super graduate. So I was excelling in that, but I just didn't like what I was doing. On that journey before I started that job, I went traveling around South America, and I got very, very ill. Like you said, ended up in intensive care, and allopathic medicine fixed me. I was out within a week. I was normal. I was on antibiotics, and I thought my life could just go back to normal.
Yeah.
And unfortunately, it didn't, and it just kept getting worse and worse, and fatigue. until I met my then girlfriend, now wife, right? And she was pecking at me all the time. Come on, do nutrition, do stool testing, look at your microbiome. Why don't you see a homeopath? And I was like, no, just pharmaceuticals. It'll be antifungals, antiparasitic, antibacterials. And I was just cycling them, going into the doctor's office and saying, this is what I think I need, because I knew the chemistry and I knew what I was testing for, right? And unfortunately, it didn't work. It made my immune system worse, and I just kept getting, more fatigued. And I was on these antibiotics, and my impetigos on my skin were just coming back on my dose still. So then I went to this immunologist, and I said to him, what do I need to do? He's like, you need to cut out sugar, you need to do nutrition, you need to go on an anti-candida diet. And this was like 15 years ago.
And had anybody told you anything like that before?
No, I've never heard of that. Never heard of that. Apart from my wife, right? But I just thought she was crazy.
So, okay.
But it actually worked.
Yeah.
And so when it comes to integrative dentistry, because I agree, like before we were researching this, I really hadn't heard much about integrative dentistry. Like I think, okay, I've got to go to the dentist every 6 months, get a cleaning, get my filling every once in a while, because I don't go every 6 months. But what is integrative dentistry, and how does it differ from just traditional dentistry?
Well, I was the same, right? So I thought that same guy that told me you need to do those things, he introduced me to King's College London, and I said, oh, okay, I can go do dentistry. And I thought, while I'm doing this dental program, surely there must be a functional dentist or an integrative dentist that I can shadow. There was no one in the UK. I was like, surely there has to be someone. If there's functional medicine, there must be someone thinking about the microbiome, looking at the inflammation in the mouth, how does it affect the body? But in the UK, there really was nothing, or no one that was advertising online, or anyone that I could find. In the end, this was 2016, I found 4 people in the UK, and I spent basically my 4 years of accelerated study to in my reading weeks and off period, just going and shadowing these guys, learning what they did. So in a nutshell, I have to say that integrative dentistry, or the trendy terms of biological dentistry now, before that it was holistic dentistry, just look at the mouth as part of an interconnected system, right? Because it is part of the body. It's a window into the body to tell us how the inflammatory levels are, how the mineral balance is when we look at the teeth. I'm sure we'll talk about that later, because the teeth are crystals, and that shows us how our bone health is, if you think about it. And then looking at its innate healing capacity using non-toxic biocompatible materials that don't interfere with immune or endocrine systems, or as minimal as possible, right? And then actually looking at how do we remove oral inflammation and increase our potential for maximum epigenetic wellness, right? That's the way that I look at it.
Okay.
And actually, when you think about it, it covers so much, because I mean, you've probably seen me talk about things. I even do airway breathing. What's that got to do with it?
And we're going to get, literally, that is on my list, because again, before I was doing research for this and kind of looking at a lot of your content, I hadn't heard about it. They call it like the myofacial dentistry, right? Or myofunctional dentistry. And I was like, what is this? And as I started to listen to it, I was like, holy moly, like this is really interesting. And it was stuff that I had never heard of before, but it absolutely made sense. And so
they say the eyes are the window to the soul, but I'm starting to think maybe the mouth is the window to the soul. You sold me, like I'm convinced.
Yeah, at least the window to the body. But
hey, I bet you guys laughed at dentists, back in the day. Look at us now.
I know, exactly. No, you're right. I never laughed at dentists. I was always afraid of them. When I saw them, I cried. But so it sounds like integrative dentistry or biological dentistry is focused as much on preventing problems as it is addressing problems, which I think is phenomenal. And it seems like it's something that's really pertinent when you consider the fact that, I don't know about in the United Kingdom, but in the United States, about 49%, 50% of people have periodontal disease or poor oral health. And people, when they hear that, they think, well, okay, bad teeth, not a great thing, but it's not the end of the world. But the reality is, like you kind of said, it's all interconnected. So can you kind of tell people, how does oral health affect the health of the body overall?
Well, if you think about, like you said, periodontal disease is essentially bleeding gums. What are bleeding gums? They're leaking gums, right? So the window, my German friend calls it, the firewall is open, right? The tooth structure of the gum should be attached gum around the tooth. So when that is leaking, what does that allow? Our mouth, our inflammation status, endocrine toxins, everything that's coming from the digestive process in the mouth and the bacteria, right, depending on the bugs you've got living in your mouth, into your bloodstream. What does that do? It activates systemic inflammatory markers like IL-6, which is what you don't want in your bloodstream, and C-reactive protein, which we measure, right, as a measure of heart health. So these things actually lead or potentially lead to cardiovascular disease, diabetes, and neurodegeneration. But if you think about the whole system, like when you look at inflammation, you can measure inflammation in the body and you can circle it back. This is a crazy topic which you guys may have not even heard of, so I'll bring it up. But when we have areas of the jawbone that have not healed properly, we're finding now that there's low-grade inflammatory markers such as RANTES, it's called, CCL5. When we look at things as medics and dental professions, we look at acute inflammation, don't we?
Right.
But actually, the non-healing sites in the jawbone drip feed and activate our fight or flight, nervous system on a cellular level, day in, day out. So we're finding now that the Germans, Dr. Lechner is a pioneer in this field. They call him Mr. Rantes. He's been doing this for 30 years. And he's found that in tumor cells, there's a 30 to 50 times higher Rantes. They find they dissect the tumor cells and they measure the Rantes in it, and they circle back to the side with the lymphatic drainage, and they measure the Rantes in the jawbone, and they find it's 30 to 50 times higher there. They remove it, they test the bloods later, and the levels drop hugely. So it's like this whole world that's opening up.
Yeah, I mean, because I think the truth of the matter is acute inflammation serves a purpose, right? It's the chronic inflammation that is potentially deadly. So we're going to do kind of a lightning round. I'm going to...
Well, and before we do that, though, I want to say that, I feel like just in general, when you talk about medicine, there's this increasing awareness of the dangers of chronic inflammation, Like you're hearing now that chronic inflammation is, some people would say, almost the underlying cause of everything that we worry about, and that addressing chronic inflammation could in turn make people a whole lot healthier, and one of the sources of chronic inflammation, of course, is the mouth. So yeah, I mean that makes perfect sense, but I still think when people hear it,
no one looks at the mouth for these things. You take a tooth out, the gum heals over the top, you think fine. Or you have a root canal or a dead tooth that doesn't hurt anymore, you think fine, there's no problem.
Yes.
But what that's doing, drip feeding that system all the time, which is putting you higher risk, right? Which is what we want to reduce.
Right. I mean, yeah, chronic inflammation is linked to heart disease, dementia, all types of things. But okay, so when it comes to heart health and oral health, what's the connection there?
Massive connection. So we're looking at, you're going to love these guys, Porphyromonas gingivalis, right? It's a bacteria found in the mouth. And Fusobacterium nucleatum. How badass do they sound?
Oh, I'm going to get a tattoo that says that.
But they are directly found in the bloodstream when we have those leaky gums that I was talking about. Yeah. They promote the formation of atherosclerosis plaques, right? And they trigger immune responses, right? So those immune responses will trigger the acute constriction of the blood vessels and make things more likely, right? So it's like this whole, we always say in the biological dental world, a lot of the time, unless you've got a massive abscess or someone's really low, energy-wise, nutrition-wise, it's never going to kill you quickly. It's like never an ICU thing, but it's about just removing the oral interferences to preventing, moving you away from that threshold of something happening, right? And those bugs living in your mouth, getting into your bloodstream, your body has to deal with day in, day out. So if you can balance that playing field, push the dynamic equilibrium back to the good bugs that what we want in there, the ones that help us remineralize our teeth, the ones that help us break down our food, they take care of the bad bugs, right? So that's the whole thing of periodontal disease, right? Just an imbalance, dysbiosis. We want the balance back.
An imbalance between the good and the bad bacteria. So did you say that they actually found these bad oral bacteria in these plaques in the coronary arteries that lead to the obstructions that lead to heart attack?
Yeah, and then there's the Porphyromonas gingivalis is the one that induces endothelial disruption and disharmony. Right? So that's the blood vessels.
Yeah. And it's not just heart disease. I mean, that leads to stroke, that leads to peripheral vascular disease, it can lead to renal disease. It's really any diseases of the blood flow. So
okay. So there's this pretty well documented link between oral health and heart disease. What about diabetes? I think a lot of people are surprised to find that poor oral health can lead to diabetes as well.
Yeah, I mean, the way that I think about diabetes and the high blood sugar, it reduces our white blood cell activity, right? And when you have, um, if you think about your mouth, it's like this place of, like a cauldron, I guess, and the saliva comes from your saliva ducts into the mouth, and it has your white blood cells in there, your remineralizing agents, your saliva to keep the bugs moving and flowing. But if you're having a lot of your body's resistance to the sugar going in the right places, then your neutrophils are going to be down, right? So then your mouth is not working optimally in the balanced state. So then you're getting more leaky gums, right? Because then more periodontal disease, which then increases. It's just like a vicious circle.
Yeah.
So what we try and do is manage both, and we actually. So our thing is always nutrition, obviously, and at the same time, when we clean the gums, and we've done a few experiments with some of our friends and family, we clean the gums without even looking. So the HbA1c, right, the marker.
Yes.
We just do periodontal cleaning. We measure there to start with. We do periodontal cleaning, really on the oral hygiene, right, really good, really low inflammation. Then we come back and we measure the A1c again in about 3 months. It's dropped, and we haven't told them to change the diet. We've told them just to clean their teeth better.
And that's amazing, because A1C basically is a measure of your blood glucose over 3 months. And so it's something that if it gets to a certain level, you're considered pre-diabetic or even diabetic. And it's something that in diabetics we want to control. So that's actually, that's a hack. 'Cause sometimes my A1C gets up there a little bit and I need to get it down. So that's a good hack.
So you're literally seeing people's average blood sugars over a 3-month period come down just with good oral hygiene alone, not changing their diet, not decreasing their intake of sugar at all. That
sounds good to me. I'll brush my teeth again. And then, okay, so what about cancers? And I know that's a big umbrella term, but when it comes to oral health and cancer, I knew about heart disease, I'd heard about diabetes, but what about this connection between poor oral health and an increased risk for certain types of cancer?
I think that this one isn't as plain cut as you see, right? But my burden is that I guess my theory on this whole thing is that the burden of the body increases when there's unknown things going on, right? And you don't know what you're controlling. So if there's these things, like I said, everyone's got this threshold of symptoms. And if we're down here and you've got oral health problems, you're kind of going through life like that with no symptoms. But as soon as you push towards a symptomatic threshold, and that's with your inflammatory levels, that's with your diet, nutrition, sugar, things that increase the potentiality of these low-grade chronic things, genetic mutations. The statement I made earlier with the rantes, high levels, 30 to 50 times higher in the jawbone from previous extractions that have not healed well, root canals that have abscesses on them that haven't been x-rayed to see if there's anything going on, or dead teeth that we don't know that they're dead because we've not done a jawbone scan to see what's going on under each of these teeth. Because a lot of the dental regular checks that we do, right, are just those small x-rays that look at the top of the teeth. So those small x-rays that look at the top of the teeth just look for decay and health of teeth, right, at the top of the teeth. Sometimes when the first thing I do is when I see a patient is I do a jawbone scan that opens the whole jaw like that, and we can see absolutely everything underneath each tooth. And if there's anything questionable there, we do a 3D cone beam one, so we can check, is there something going on there? And if there is, then we know that there's an abscess, an inflammation underneath the root, silent because the tooth has already died, or there's been a root canal that's removed the nerve of the tooth, and that is low-grade chronic drain on the system. And I truly believe when there's too many low-grade chronic drains on the system, the mitochondria dysfunctions, the inflammatory system dysfunctions, the body can't clean cancers, because cancers happen in our system all the time, don't they? It's just about our body being able to clean them up and move on. And it's just a dysregulation of our system, right? Our immune system is how I look at it.
Yeah, our immune system's
So it's
almost
just
in
an
flux.
extra burden.
Yeah, it's kind of like the immune system is in flux. And if you think about the immune system, it's got to do so many things. Like you said, all day, every day, we make cancer cells in our bodies, but our immune system recognizes these cells and clears them. And all day, every day, our immune system's being exposed to potential allergens and bacteria and viruses, and it's recognizing all of these things and clearing them. But if you overburden your immune system and it's, dealing with this chronic inflammation from a tooth that hasn't healed or an improperly done root canal, now your immune system's like, well, I can only do so much at one time, and other things start to fall through the cracks. And that's why I love that theory, actually. And that's why you start to see an increased risk of cancer, because it's crazy. When I was doing the research, people with poor oral health had an increased risk of head and neck cancers, which I could kind of intuitively make some sense of. But then there was gastric cancers and colorectal cancers and breast cancers and prostate cancers and uterine cancers and liver cancers and things that you wouldn't necessarily directly relate to oral health. But again, if your theory is correct, and I think it's spot on, your immune system is busy taking care of one thing here, things over here just kind of get missed. So, wow.
Well, that's it.
Yeah.
And the other thing I was going to add to that's the inflammatory point of view because it's always like how our body deals with something, but then it's also the bugs that are living there too that can cause this state, right? So if our mouth is overrun with those funky name bacteria, right, that cause disease, pathogens, then actually they can get into the gut, they can get into the colon, they can get into the bloodstream, go to the organs, right? So that's kind of how I look at it too.
Yeah, wow. It's like it's a multi-pronged attack, or maybe a single-pronged attack, but then your defense system's down and the things
on multiple levels. Basically.
Yeah. Okay. So I think one thing that surprises people a lot of times is there's this link between oral health and pregnancy complications. Yep. And we're obstetrician gynecologists, and so I remember learning about this in our residency training. We had an attending physician who would always really, not browbeat us, but anytime we had patients who came in with preterm labor, he's like, tell me about their oral health. And we're always like, what are you talking about? That's not the orifice I checked. And he would always be like, hey guys, this is a big factor. And I did some research, and in fact, they guesstimated that about 1 in 5 cases of preterm labor could be directly linked to poor oral health. I mean, obviously, you doing what you do, and having that kind of global view, I imagine this doesn't surprise you much. But does that link kind of make sense to you? Can you visualize in your link, or in your head, what's happening, what that link is?
So much so that one of the dentists that's working with me now wants to create a pregnancy wellness routine from the oral health perspective to support expectant or mothers to be that will want to be, right, trying to get them pregnant and hold the baby. Because I mean, my mode of action, I think about everything quite literally. And when you hear that a female's been really unwell, she's lost a lot of weight, she's not looking after herself, the first thing to go is the period a lot of the time, right? So the way that I look at it, same in the mouth. If you're letting your mouth go, you're not looking after yourself, there's a lot of stress going on, your body is going to release more inflammatory compounds like prostaglandins and tumor necrosis factor, right? They are released from the gums, they enter the bloodstream and affect everything downstream, the uterine environment being one of them, right? And let's not forget that when you're trying to, or when you are pregnant, you're growing and developing, your immune system's even more high alert than normal, right? Because it says, right, I need to protect this baby, I need to grow, and also I need to feed the baby, so the inflammation wants to be carried to all the nutrients, right? But everything becomes much more reactive. So I think it maybe just pushes the process on quicker than it's meant to be in some cases. I don't know the exact mechanism of action, but I know that it's to do with the prostaglandins and the tumor necrosis factor. That's the main thing.
Yeah, and I've also heard just getting an increased bacterial load in the bloodstream in and of itself, because infection frequently is a cause for preterm labor. Okay, so let me ask you this. So, when we were growing up, Mom always said, brush your teeth when you wake up, brush your teeth before bed, and we kept it pretty simple, but I feel like there's more. I feel like there's something maybe that we're missing. So what do you recommend for optimal oral health? Is it just as simple as brushing twice a day and see the dentist every 6 months and that's it? Or is there more? Is there something we're missing?
Depends how long you want to be doing your routine every day. But to be honest,
well, I don't know. What do you recommend? 5 minutes, 2 minutes, 1 minute? What's good?
No, 2 minutes is here's a really interesting thing. All the research was based on 1 minute. So then they thought, but people might not do 1 minute. So let's tell them 2 minutes.
Yeah. So they'll actually do a minute.
Yeah, but two minutes is fantastic, because all we're doing when we brush our teeth is we're disturbing the biofilms that are on the teeth, so they can't stay there for too long and become anaerobic, pathogenic, bad bugs, basically. Now, what you add on to a toothbrush, the mechanical action part, is you add in the toothpaste, which has the mineral benefits, right? That's when we use things to help lower inflammation in the mouth, bind to things, and also remineralize our crystal teeth. And I'm sure we'll come on to the toothpaste and the different ones later, but my perfect morning and after, I'll tell you my perfect routine. What I do every day, make sure you have a good hydration of water because your saliva has dropped overnight. You need to get that saliva flow going again, and you use 500 mils of saliva every single day. So you need to drink at least 500 mil, right? That's crazy. Just for saliva.
500. Okay.
Obviously, we absorb a lot of it again, right?
Yeah,
But a lot of it's turned into mucus and stuff. But so hydrate straight away. I actually tongue scrape.
Okay.
So stick out the tongue, get the bugs that have been accumulating over the night off the tongue. And then I actually do something pretty crazy. I get a little bit of cooking coconut oil because of its mild antimicrobial activities, right? And I put it in my mouth, and it's hard to start with, and then I push it and pull it. And it's called coconut oil pulling. And I'll do that while I'm doing my exercise, making my smoothie for the day, and taking the dog for a walk, so no one speaks to me when I'm on a walk. And then and actually the benefit to that is your lips are together, you're nasal breathing, and I do my exercise in my little home workout, so I know I'm nasal breathing while I do it. The top tip for that is you spit it out into the bin afterwards, not your sink, especially if you live in England and it's cold. It will block all the sinks and everything. And then you just rinse your mouth out with a salt water. That's all it needs to be, just to get the fatty stuff out of your mouth. And then you brush your teeth as normal. So that's the morning part of my routine.
Okay.
During the day, if you can, you want like a mint or a hydroxyapatite mouthwash after you've, eaten your food at lunchtime. That's bonus points. Not everyone's going to be able to do that, right? And then at nighttime, the only difference I want is there's no coconut oil pulling, and you're cleaning in between your teeth.
Okay.
Absolutely in between your teeth, because you've eaten all day.
Yeah.
So you want to get all that food out of the in between the teeth, and then you brush your teeth because you want to get the food out, expose the mouth to more surface area of remineralizing with the toothpaste and brushing, and then you have to, and we'll come on to this, nasal dilate and mouth tape over the top, right? Because that is going to help your oral environment too. I'm sure we'll come on to that.
So it's funny he mentioned the 1 minute to 2 minute thing, because my toothbrush actually times, so it's like 30 seconds here, 30 seconds, so I do the 2 minutes, and the 2 minutes seems like it's forever. So that's why they basically say 2 minutes, they want you to do 1 minute.
Okay, so you kind of mentioned the oil pulling, which I was going to actually ask about, because that's become kind of this new thing. Although I did some research, and it's not so new. It's actually pretty old, yeah. But and there's been a lot of talk about whether or not it works or doesn't work. And it's funny, when I did this research, it really reminded me of how what's old is new again, because apparently this is something that is from Ayurvedic medicine in India, and it's thousands of years old. And they said that some of the old Ayurvedic texts even mentioned that it was good for not just oral health, but heart health, diabetes. And so it's like they knew even
all the stuff
then,
we're talking about.
Yes, they knew even then that there was this link between oral health and overall health. So how exactly does the oil pulling work? What my understanding, but this is not a very refined understanding, is that it just kind of coats the teeth, and so it protects the teeth from this biofilm that you're talking about, this combination of bad proteins and bacteria and things like that. But is there more to it than that?
Yeah, I always laugh about this because I did my dissertation in dental school on coconut oil pulling, and they failed me because they just didn't understand it.
So I don't feel so bad.
There was probably only about 2 studies back then that actually showed. It was a really good one because they did a randomized control triple blind study about coconut oil pulling, and they found that coconut oil pulling versus chlorhexidine, which is Corsadil mouthwash, it was equally as effective in the 3 weeks, and it actually said that it's a good natural adjunct to mechanical cleaning. So they found, let me just read it out, they found significant reductions in plaque and gingival scores among the oil pulling group compared to the chlorhexidine. And you could look at that in 2 ways, right? Is the chlorhexidine just killing good and bad, and therefore bleeding scores might go up because the bad bugs are overtaking them if you do it for too long? But I think you're right, that oil pulling coats the teeth, it makes it less likely for plaque to stick onto it, therefore calculus build up in the long term. The mild detoxification things, there's no real science behind that, but I've been doing coconut oil pulling for 7 years now, and I still do it. And do I get ill as much as I used to? don't think so. Do I get ill as much as those people around me? I think it's really good just to do. You've got to find the time, and you can't be stood there just because it takes so long, right? You want to try and do it for up to 20 minutes. So you've got to be filling your time, having a shower, going out to the gym, walking the dog, whatever it is while you're doing it, so you can actually, and the medium chain triglycerides, right? I think it's caprylic acid. They've got that mild antimicrobial effect, but they also, who knows, they surely, because our blood, look at under our tongue, right? All of those blood vessels, we spray life-saving medicine under there, don't we? When someone's having a heart attack. So if you're putting good oil into your mouth, surely your bloodstream is going to take some of that in.
I had never thought about that, but you're right. We give sublingual medications all of the time because it gets into the bloodstream directly. So those healthy fats and coconut oil,
that makes it okay. So it sounds like you brush, you scrape, you do your oil pulling in the morning. You do something midday, which I don't do. I probably need to start, and then in the evening you brush. Okay, but what about mouthwash? What about mouthwash? I have a feeling I know where this is going to go based on something you said about the chlorhexidine, but what do you think about mouthwash?
I mean, exactly, chlorhexidine, if you think about it, and mouthwash, most alcohol mouthwash, not all alcohol mouthwashes are bad in my opinion. No, all alcohol and all chlorhexidine are bad in my opinion, but not all mouthwashes are bad. So what I try and say is that what do we want from a mouthwash? All we want from a mouthwash is cleansing, cleaning, fresh breath. That's all you need, right? So when you think about fresh breath, you think of the bugs that live in your mouth and in your stomach. So if you're using a napalm strike, like alcohol every single day that wipes out all good, all bad, eventually if you're doing that day in, day out, the only things that can survive are the bad ones, right? They learn to change, they learn to adapt, they learn to live in that environment. And most of the time, those are the bugs that create bad breath, right? So that's what you don't want. Not to mention the remineralization of the teeth, the digestion of the food, things that you just don't want to do. So my top tip for mouthwash is boil some water, chuck a load of saturated salt in there, as much as you can. Good salt, Himalayan salt, Celtic sea salt. Have it as a cup with a little lid on at the side of your sink. After oil pulling, you put it in your mouth, rinse it around, spit it out once. That's all you need to do, because you're balancing the pH and you're just removing the excess oil from the mouth so it doesn't feel too bad. You can get funky with them, but you don't need to.
And a lot of bad microbes anyway, bad viruses, bad bacteria are like halophobes. They don't like salt anyway, so that also would kind of target the bad ones and hopefully spare the good ones. So, okay, I'm learning a lot of tips. My teeth are going to be looking amazing. Okay, I want to ask you a question. Not even my teeth. I don't care how my teeth look. Well, I do care how my teeth look, but I want to be healthy. I'm almost 50, so I'm starting to worry about a lot of this stuff. But flossing is something I just want to touch on briefly. I was having a discussion with someone recently, and this person flossed before they brush. And I floss, well, I'm a little weird. I brush, floss, brush. But we were having this discussion. Do you floss first and then brush, or brush first and then floss? What do you think? Stupid question, but I have a bet to win here.
To be fair, I prefer doing it before brushing, because if you think about it, the mode of action for brushing is getting flossing or interdental cleaning is to get in between the teeth, to get food out, to get bugs out, to break up the biofilm. So you want to do that before you brush your teeth, because if you did it and then if you brush your teeth and then did it, where does that go? There's been no toothpaste coating those areas to remineralize and support it. So in my logical brain, I don't think there's research behind this at all, guys, but I interdental clean first and then I brush my teeth. Flossing for me, I actually only do flossing between the canine to canine at the back of the mouth, because the roots are kind of grooved. I think that's the way flossing, when you go in and out, it misses a gap. So you really want to be getting something with bristles in between the back teeth, or they're called easy picks, and they have little knobbly bits on them, and they push things out as well. Because the floss sometimes misses at the back of the mouth. That's the thing that I learned But also my favorite, by the way, is the water pick.
I was going to ask about the water pick.
Yeah. You put a bit of iodine in there with your water, and you just swish, push it around. And then also, if your other half's been winding you up, you go, oh, sorry, got you.
Yeah, there you
See,
go.
I'm gonna have to try the iodine, because when I first started using a water pick, like I felt like I was power washing my mouth. Like I probably had some periodontal disease, 'cause my mouth was bleeding like mad when I first started using it, because I put it on the highest setting. But I think the water pick is, I just wanted to go for the gusto. Like, I'm not gonna start at number 1. I started at number 10 and I was bleeding like mad. This is during COVID. But anyway, so I much prefer the water pick to flossing. But you do the water pick and you floss between the canines. Okay.
Again, I'd never heard that.
Yeah.
I just flossed my entire mouth. I didn't even think, okay, that makes sense. Okay, all right, so I want to ask you another question, and then I really want to get into the myofunctional dentistry a little bit more, but fillings.
Yeah, cool.
There's been a lot of controversy surrounding fillings, you know. Certain materials may be unhealthy, certain materials may be less so. What is your thought about fillings, number one? But before you answer that, I'm wondering about cavities in general. We've always been taught that you have cavities, you need to fill them. But are there ways to heal cavities without fillings? And if they don't work, then what do you think about fillings?
I mean, this is a really amazing question, and you know, I am as much as an expert as I can get to, I guess. Right now, I've drawn from fillings or teeth. Remember, they're crystal, so they have these blood. So let's say this is a back tooth with 2 roots. It has a blood flow and a nervous flow and a lymph flow in there. So you can actually look at teeth like little mini organs in a way. And what they do is the blood flow should go in and it should deliver the nutrients, the minerals, to your tooth to help it remineralize from the inside out. So if there's a mineral disbalance, it's not going into the right places within the body, it's been taken from the teeth and the bones rather than being put into them, you're going to notice someone will have more decay or caries is what we call it. And actually you see that in women that are pregnant, right? Because of course they're giving all their minerals to their unborn children, growing their bones, growing their teeth. You know, that's really important. So yes, we look at the tooth from the bugs that live in the mouth that cause the dental disease. Streptococcus mutans is the one that we can measure. But actually, is it a different story? Is it our bodies not working in that dynamic equilibrium to keep flowing all the minerals and nutrients, so then the bugs and the acids can demineralize the teeth and create holes in them? Can you remineralize teeth? I totally believe you can, and I've seen it in my case studies. The enamel layer on the top of the tooth is the layer you can't really remineralize. You can just stop it and strengthen it. So that one turns black and goes hard. The inner layer, dentine, is alive and it has that nutrient supply. So if you get into the first third of the dentinal layer and you're looking at an x-ray and you're saying, yeah, I think we can try and remineralize that. We take the pressure off the tooth in terms of the bite and the airway at nighttime. We get them eating a good nutritious diet. And then you get them remineralizing with things on the top and the nutritious diet from the... So it's basically outside in and inside out. And the work that Dr. Weston A. Price did in the 1920s, he went to all the indigenous places in the world still, looked at all the tribal communities and found that they had straight teeth, no dental decay. And when some of their siblings were going to the Western world to study and come back, they had dental disease and problems. So he's put it down to refined diets, high sugar, of course, but also there's a mineral called K2, and K2 is the master mover which puts the minerals into the right places. And if you don't have K2, D3, which is what we create, you know, teeth and bones from our calcium stores and phosphate stores, doesn't do its job properly. So K2 is that X, he called it activator X back in the day, but now we know it's K2.
Yeah, and even with patients that have osteoporosis, same thing, like we'll give them calcium, but we also tell them, you know, calcium, vitamin D, and K2 to actually get that calcium to be taken up in the bones. So yeah, okay, so that's actually very interesting.
Yeah, this is all tremendously interesting. Like I could go on and on and on and on. Okay, so but I want to get into the
myofunctional dentistry. What is myofunctional dentistry? Because I've never heard of it. I have to be honest. I've never heard of it until I started researching. But what is it?
Teach this guy.
Teach me something, please. Teach me something else. I've learned so much already. But
I would say that it was my first love in this biological dental world, and what it is teaching. How I came about it was that the tongue is the biggest, 8 different muscles in it, right? So what the tongue does and how we breathe dictates where our teeth position is and where the teeth settle in the jawbone. So I first came across this when we were we went to Holland of all places, and we were looking at MyoBrace, is the company that I first heard of, and they use these. It's called myofunctional appliances, and they're just silicone. So that is not orthodontically, like, it doesn't move teeth at all, right? But what it does is it stops the muscles from activating and touching the teeth from the outside in, the lips and the cheeks, and also the tongue from the inside out. So what we're looking at here is in myofunctional dentistry is we are getting so let's say this is a spine, this is the tongue. We want your tongue up and living up here. So you can breathe in the nose, behind the tongue, nice and easy. So it should be just behind the top teeth and suctioned lightly to the roof of the mouth. So when that's happening in that position, we actually breathe more effectively. But as we're growing and developing, when those muscles are pushing on the inside out and not swallowing like this, right? You're not pulling. So we're activating the muscles to be more positive, to activate the maximum genetic potential. So we're tongue up and out and swallowing by pushing like this. So the top jaw is growing upwards and outwards. It frees the lower jaw to come downwards and forwards. And actually what happens is the teeth all go in alignment, right? So as you're before 10 years old, you can do this all day, every day, if the kids are committed. That's the hard bit, if the kids are committed.
Good luck.
Yeah? But as adults, we can still do it because there's this book by Felix Lau, which is amazing. It's called The 6-Foot Tiger in the 3-Foot Cage. The cage is the teeth, the tiger is the tongue. So what we do, even as adults, is we tone the tongue, get it living in the right place so it can fit within the smaller cage. And then if we need to, as adults, we have to expand the jaw, change braces, and all those fun bits. But in children, we don't need any of that, right? Because the bone is soft and pliable. We're pushing on the teeth which grow the bone. So then we've come into this remit of, actually, we're intervening years ahead of time, and actually they're not needing orthodontic therapy. I've seen some pretty crazy cases that people would have said, right, you need 4 teeth out to have braces later.
Okay,
don't need it anymore.
Where were you? I've got 5 kids and they've all had braces, which cost me tens of thousands of dollars. So this information's come a little too late, but
what's really interesting, I've been on your Instagram and I've seen kind of some of the before and afters, and you would swear these people had like orthodontics. They had no. It's the myofunctional dentistry, and so there's a cosmetic benefit to it for sure. But it sounds like it's more than anything. It's a functional benefit. It's improving how you're breathing. It's improving the function of your airway, basically.
Oh well, if you correct this when you're young, your teeth grow and develop into a nice uniform arch shape. It's easier to clean your teeth. You get better loading of all the teeth. They're more balanced. You get less breakage, less decay, less gum disease. As you're older, your tongue lives in a better position. So when you're sleeping at night, it's not obstructing or blocking the airway. So you're staying in that deep sleep, right? So we're intervening before 10 years old, and hopefully that's lifelong benefits of preventing sleep apnea potentially, right?
Wow. And is this what people are referring to when they refer to tongue posture? Because I've always been complimented on my impeccable tongue posture.
Right.
Is this what people are referring to when they talk about tongue posture?
That's exactly it. And I can show you, right? So not that I've grown my beard out a bit because I've been on holiday, but if I go low to up.
Oh yeah, I can see the difference.
Oh wow. Okay.
So it's really just about this being flat, with the tongue
up like that.
living in the roof of the mouth.
Okay.
And I can actually, if my tongue's low, my lips are together and I breathe in, you can see that my nasal aperture closes, right? But if I put my tongue high and breathe in, totally different, and I'm taking the same depth of breath. So it actually even impacts your nasal breathing ability and the cartilage around the nose because the airflow is less turbulent.
I wonder if that would be beneficial for somebody with a deviated septum too, because I've got a deviated septum, and I feel like on the side where the deviation is, I'm never quite getting the same airflow, This kind of leads me to another thing. I saw a post of yours, and it actually got covered by the New York Post in 2024, where you were talking about the nasal clearing. And you had said that, kind of paraphrasing, you said that it may be just as important or more important to do nasal clearing as it is to brush your teeth. And of course, it's social media.
Trolls will troll.
Yeah, trolls will troll. You had all of these people who, But I started thinking about that, and kind of the way I understood what you were saying was, again, if you're breathing more effectively, you're not stimulating that fight or flight response, because if we think we're not getting oxygen, we panic, fight or flight kicks in, and then that disrupts our sleep, and then that's basically not good for your health. And so looking at the overall, importance of health, probably brushing your teeth is important, but breathing better when you sleep, breathing better, tongue-tied when you sleep is more important. But so is that what you're talking about when you're talking about nasal clearing?
Yeah, well, basically, yeah, that clears the nose, and that just means you're more likely to keep your lips together and your tongue high when you're sleeping at nighttime. And yeah, you're right, because if your tongue blocks your airway, you go into fight or flight, your brain's like, I need oxygen. You clench your teeth, which damages your teeth, oral health, need more fillings, or you grind your teeth, which causes periodontal disease because it puts weight on teeth in areas that they're not meant to be. So it pushes them further past their neutral zone, and then you get pockets around the gums, and then you get the bugs that are living in there. And also, if you're mouth breathing all night, you're drying out your oral environment, so it's then there's no saliva supporting the washing away of the bugs and dynamic equilibrium. You're getting more anaerobic bacteria building up because they're forming these plaques and hiding away in areas. So yeah, I mean, brushing your teeth is equally as important, but it is true, right, that actually if you look at the impacts of not nasal breathing at nighttime from a holistic wellness point of view, but also from a inflammatory point of view, you've got double whammy.
Yeah.
Okay. Well, this has been.
Just one more thing. We are running a long time.
You always have one more thing.
I know, we are running a long time, but I just wanted to touch on one more thing very quickly. Essential oils. I was on your website, and I see that a big part of your health and wellness package and recommendations involves the use of essential oils. Can you just talk to us briefly about that? Because I've started to get into them a little bit more, but I'm an essential oil neophyte. So can you just talk to us a little bit more about that?
Well, after I had that craziness when I was younger, not being well, it was, well, I need something in my mind that's a bridge between the homeopathic world and the pharmaceutical world. And I found that essential oils were an amazing foot in the door, because I don't know how many percentage of pharmaceuticals are just isolated compounds from nature, right, at the end of the day. But what you do with an essential oil is you'll have 1 to 1,000 chemical compounds, natural ones, in that oil. And you can take, I mean, I just done a surgical implant up there, and what have I given her to help with her post-op surgery? I've given her a blend of cloves, cinnamon, wild orange, eucalyptus, rosemary, and another oil, carbaiba, and that helps pain, inflammation, infection, but also increases blood flow to support good gum attachment and healing. And she'll be dabbing that on there and on the inside of the surgical site for the next 3 or 4 days, because that's the highest risk of infection, and that's when you want the gums to attach tightly to the implant. So yeah, I'm a big fan of them, and for me as a scientist, I could logically study the compounds that are in the oils and what they do in the body, so I knew how and when to take them. But I mean, I have supported so many people even before I got into dentistry, because I kind of did that at the same time I was doing dentistry. And that's what opened my eyes to the natural world. So I've got a lot to thank to the old oils.
Wow, that's amazing. That's amazing. Well, thank you so much for joining us. Tell people, where can they find you, Dr. Seb?
Oh, well, I'm in the north of England, a bit far away from most people, I'm sure. But if you want to follow and learn from the content online, I'm just Dr. Seb, really, the biological dentist. And yeah, I give free content all the time to learn and observe and do and practice, like the nose clearing, to help you at home. And also I run some online consults if you're stuck on what you want to do and whether the mouth could be a thing. So I do support people from all around the world with my limited time. But yeah, thank you so much, you guys.
Thank you so much. We'll definitely have to do this again. And I honestly may stop by your dental surgery. I really may. Like, this stuff is amazing. Like, I'm so motivated now. I may darken your doorstep, but
literally.
It'll
be a dark day.
Anyway, whatever. All right, thanks for joining us, Dr. Seb.
Take care, guys.
Thank you.
Take care. All right, guys. Well, this appointment is almost over, but first, today's Gross Anatomy.
Yes, I was going to say, not over yet, though.
First, our Gross Anatomy session, which comes from Nairobi, Kenya.
This is how I hold my brush. It is very hard for me to grip it, as you can see.
The worst thing with living with oral disease is that you get your condition is just worsening each day by day.
23-year-old Haroon was born with a rare skeletal disorder known as Ollier disease, which causes abnormal bone development.
It has affected my shoulder. As you can see, there is a big growth here, and my hands, as you can just see, I have to wear those clothes that they are elastic. Yeah, it is hard to walk as I feel pain here when I walk. Yeah, especially in a long distance when I stand for a long time.
It has been very hard for me to live with such a condition. Hi, ma'am. How are you? How are you?
Fine.
Okay, thank you. Thank you for visiting. You can just have a seat. Have a seat.
Na sasa hakukuwa amezaliwa hivi, alikuwa amezaliwa kama mkono hii yangu mzuri, alafu ikaanza kitu kidogo kidogo hivi kwa joint kidogo hivi.
So Ollier disease, thankfully, is rare. Only affects about 1 in 100,000 people. And it's what we call a somatic mutation, which basically means that it's just a random chance mutation. When you get it, though, you basically get the formation of what are called endochondromas. These are benign tumors made up of cartilage that affect the bones. They cause disfigurement, they cause pain, and they make the bones very brittle. No cure for it, unfortunately, but they can remove the endochondromas, stabilize the bone so there's less risk of fracture, and typically people do physical therapy just so that they're more functional. And that is today's Gross Anatomy session.
This session is over. The podcast is over, but it is time to head on out to the front. Make your next appointment for the next appointment of the Second Opinion with Twin Doctors. I'm Dr. I.
I'm Dr. J. See you next time.